Perfect. Well, thank you so much for spending your Sunday with me. I'm really, really glad you're here.
I'm glad I was invited. I'm excited to talk to you.
Awesome. Well, why don't you introduce yourself to the audience?
I'm actually a functional physician, and I'll talk a little bit more about what a functional physician does. So, a functional physician is a physician whose role is to be able to understand the root cause of disease. So, most of the diseases that we are facing at this time are chronic diseases. So, for example, heart disease, autoimmune disease, diabetes, stroke, these are chronic diseases, which means that these are diseases which, once you have them, you may have to deal with them for the rest of your life.
Right.
And the solution that we have from the conventional perspective is to give a medication. So if you have high blood pressure, depending on your blood pressure, we'll give you 1, 2, or 3 medications. If you have diabetes, in addition to that, then we'll give you a couple more. And then if you have high cholesterol, then you'll have some more. So basically, as you keep on accumulating diseases, you keep on accumulating medications. The role of a functional physician is to be able to figure out why are you developing these diseases and what is the root cause of it, so that if you look at, for example, high blood pressure, and you look at diabetes, and you look at high cholesterol, all three of them have actually one primary root cause, which you can connect with all of them, and that is inflammation. And so the role of the functional physician would be that, does this patient actually have inflammation? And if that person has inflammation, then what is the source of that inflammation? Because if you can identify that, we know that these diseases are also called lifestyle diseases, because a lot of what we have is related to what we're exposed to. And I'm not just talking about food, because that's what, ultimately people go to food and they go to physical activity. And yes, those factors definitely count. But the other factors, for example, the bacteria in our gut play a very important role. Our hormones play a very important role. Toxins that we're exposed to play a very important role. Nutritional deficiencies play a very important role. So my role as a physician is to be able to figure out what are the root causes and to address them, so that not only are you able to reverse what you have, but you're also able to prevent the development of more chronic diseases. So that is part of my work as a functional physician. My other role is that I'm a mindfulness coach. And this role actually came after I became a functional physician, and I realized that a lot of things are already known, except that we cannot necessarily apply that information. For example, we may know that we shouldn't eat X, Y, and Z, but it's very hard for us. A lot of us are emotional eaters, because when we are stressed, we need something to make us feel better. And so we go with food. So it is not really the fault of the person that they're using food, because if they do not have another option to deal with their stress, and that's the only option they have ever been taught, that's what they're going to do. And so my role as a mindfulness coach is, how do I help this person go from knowing to actually applying?
Yeah.
And because functional medicine is a lot about lifestyle changes, a lot about thinking about how we are living our lives, a lot of changes, and those changes cannot come without coaching. And so that got me into mindfulness coaching. So I'm a functional physician and a mindfulness coach.
Awesome. So how did you find your way into functional medicine, and what drew you towards it to begin with?
So I actually finished my residency from Hahnemann Drexel University. And after finishing that, I was very excited. Finally, the journey, was over, and I'm going to practice something. I completed my boards in internal medicine, and I joined Penn as an academic hospitalist. Initially, it was very exciting, and you're always like on the go, and it's really like, okay, finally I'm actually attending, I'm a physician. And slowly and gradually, I began to realize that, it's great because you see patients, you treat them, and they go home. But 3 weeks later, they come back again. Same patient, same problem. And then as you start looking at that, you start thinking, what are you doing? I mean, you are treating the same patient again and again and again, and the patient comes back again and again and again. And so one of my goals was, how do we fix this problem? What is going on? Why are there so many readmissions going on? And when I wanted to work on that, I realized that nobody around me was interested in that.
Mhm.
Um, it was all about get the patient out of the hospital as soon as you can, discharge ASAP,
Yeah.
which is great because the hospital is not the best place to be. And I mean, there are so many bacteria and viruses and fungi, and they're all going to be resistant. So the concept is fine, but there's a bigger problem. The bigger problem is, how do you keep patients from readmitting themselves? And at that point in time, I was realizing that and a lot had to do with what they knew about their condition, what they understood about their condition. It was also about knowing when to take their medications, what kind of support they have. So I realized that, there is a lot more to this picture, but the place where I was at, it was just about doing more and more and more. So the list of patient keeps on growing, and the bigger the list becomes, the lesser time you have with the patient. But more importantly, now the educational piece, which is the reason why this patient keeps on coming back, is never done because there's
Yeah.
no time for education. And so I was very frustrated. So at that point in time, I decided to go into the outpatient side on the clinic side of things. And I was very blessed because I started working as an associate program director with a community hospital program. I was very excited because I loved teaching and my residents were awesome. That was the aspect that I loved. And I was beginning to kind of help the patients understand their medications and to help them understand what the condition means. But one of the things I realized that, there were some similarities in both the settings. And one of the similarities was, again, that you had like literally 10 minutes. The patient has a list of 12 medications. There's so
Mhm.
many issues. And you have no time again to educate the patient. I mean, it's still the same story there.
Yeah.
The second thing I realized is that I was becoming a prescription writer.
Mhm.
I was basically a prescriber. One prescription, the second prescription, the third prescription. And it was very frustrating because at the end of the day, you know that this person is going to come back again, and this time it's going to be one more prescription. And I vividly remember this incident that I was sitting in a room with a woman. She was crying because she recently had divorced. I was worried about her. She was very depressed. I was worried if she would harm herself. And I'm trying to figure the situation out. And what I hear is a knock on my door. Dr. Ali, there is one more patient. After 10 minutes, I get another knock. There are two more patients. And I'm thinking to myself, what am I doing here? I mean, what am I supposed to do here?
Right.
Am I supposed to leave this patient and tell her, look, here is a prescription for an antidepressant, which will make you suicidal, which I'm already worried about? Or am I supposed to tell that those patients that, look, you guys will have to wait another 40 minutes because I'm with this patient? I mean, what am I doing here?
Right.
And that point in time, I realized that, this is not really what I wanted to do. Interestingly, prior to my frustrations in the outpatient setting, when I was in the pen setting, I actually went through my own health issue. I actually was doing too much. I was doing my master's in public health from Hopkins, and I was doing full-time job as a hospitalist, academic hospitalist. And of course, there were other things I was doing out of that on the personal side of things. And I actually got depressed. And of course, my work had part of it, a lot of it to do with that. And so I called one of my friends and I said to her, look, I think this is really getting to me. And she was a psychiatrist and she said, Nadia, you know what you need to take, just take an SSRI. And I said, no, 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 I'm not taking SSRI because I know too much. I've read a lot about it. I already know that. I'm not going on that. And she said, yeah, well, there's nothing else you can do. You know that. And I was really frustrated. And at that point in time, I started looking at what could I do? What can I do? And I actually found data on how I can start meditation and yoga. And my diet was really bad because I was on the floor and I would try to finish my work as soon as possible. And so I wouldn't take a lunch break. And so whatever was on the floor, and on the floor, there were basically donuts from the patient's families, or somebody has gotten some croissants, and I would just grab them and I would just, or they would have brought chocolates. And I realized that a lot of what I was feeling, had to do with my lifestyle and also my workplace. I started doing yoga and I felt so much better. And I changed my diet. And, when I went into the outpatient setting at that point in time, I had already started learning about functional medicine because for the first time, when I was looking for uh, an approach for my own mental health issues, I realized that there was so much research out there, which I was not aware of. And
Yeah.
to be honest with you, I will say I'm embarrassed to say this, but throughout my medical school, my residency, I was never ever trained into any of this. Rather, if somebody were to come and say they're going to a chiropractor, I would have looked at them and said, "What's wrong with you?"
Right.
Because that's our training was that this is all voodoo and nothing really works. And I realized that was not true.
Mhm.
So when I went into the outpatient setting, one of my goals was, can I actually help my patients do less of the medication? I
Mhm.
wanted them to do what I would have preferred for myself. But that was next to impossible, really next to impossible. And so at that point in time, and there was so much other things going on from the standpoint of workload, and it was all about RVUs, make more money, money was never enough. I mean, we could never make enough money for the health system ever. Even though the CEOs would continue to increase their bonuses every year, but still there was never enough money. And so at that point in time, I basically resigned and I started my own practice from scratch. And I think I'm so grateful and I'm very blessed that I did that because that was something that truly became the light of my life. It gave me the opportunity to do what I wanted to do. It helped me educate my patients. It helped me, you know, um, realize that there is so much I can do. I mean, it was really a rewarding experience for me. But more importantly, this journey of mine from the point of me recognizing what I needed to do to the point of me realizing that, I was expecting the wrong things at the wrong time from the wrong institutions. It was a journey of self development, and so I became mindful of, who I was, what did I want to do? What did I want to accomplish? And I had never thought about those questions till I started, dealing with barrier after barrier after barrier. And, every barrier that came brought a message for me. It was almost like the universe was sending me messages. And initially, I never read through the messages, but I got to a point where I was burning out like crazy. And that's when I was like, I'm missing something here. I've got to pause. I've got to pause. I need to ask the right questions. I don't think I'm asking the right questions. And I realized I was not even accepting the situation. I wanted to change people around me. I wanted to change institutions. I wanted to change organizations. And the truth is that, my job, our job as individuals is to change ourselves. We cannot expect the world around us to shift unless we shift. And so that understanding that I'm not responsible for everybody, I'm responsible for changing myself. I'm not responsible for making people do what they should do. Like, for example, even in terms of patients, it's not my job to tell a patient what they should do. This is not my job. I'm a coach. I lay in front of them the options, the pros and the cons, but I will not tell them what to pick. And this is the best part about functional medicine, that you are not the leader. In conventional medicine, a physician is the leader, and the physician tells the patient, you're going to take this medication or that medication. In functional medicine, physician is not the leader, patient is the leader,
Mhm.
and physician is a coach, which means that I help you understand this is the scenario, this is the option that leads to outcome A, second option leads to outcome B, third option leads to outcome C. You decide in your situation which one would work best for you. And so same thing for institutions or organization. You cannot tell them what you want them to do. So I think that mindfulness is very helpful because growth is not linear. growth will never be in a straight line, and everybody will have their own curves, and when every time you curve, there's a message. And every time you encounter, you're going this way and you face a hurdle, oops, there's a message. As soon as you learn the message, you'll be able to move around it. If you don't learn, you'll just bang your head, bang your head, bang your head, and you'll keep coming across problem after problem after problem until and unless you learn the lesson and you're like, no, 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 I have to let go and I have to pivot.
That's
And
right.
I think that that journey is so fascinating. And I will tell you, I'm still not where I want to be. I think I'm still learning and I'm still pivoting. And every time I see myself pivoting, it's wonderful. It's like, yes, I got it. Like I got the lesson, right? And so I think life becomes very fascinating when you strive, but you are willing to let go, and you're willing to say, you know what, this line of action is not working, and I'm just going to shift. So I think that is basically how I got to where I am. And I will say that there are people in my life that I'm very grateful for, who played a very important role. And just like, when the universe wants to give you messages, he sends people, he sends those messengers. The people become the, messengers, to communicate that message to you. And there are those who are very nice to you. Like, I think my resignation was written by my spouse, so he was a messenger for me, telling me, Nadia, enough is enough. I don't think this is for you. You should just let it go. And I appreciate that. And there were people who were very mean to me. And to be honest with you, I'm very grateful to them, because had they not done what they did, I wouldn't have been where I am. So the truth is, they were messengers. They were just doing their job.
Yeah.
And so I think that, we have to, one of the things I've learned is that you have to accept the messenger, without necessarily judging the messenger. They are there to give you a message, and you have to learn the message and you move on. So I'm very grateful to all the messengers, irrespective of the means with which they communicated their message to me, that they made it possible for me to be where I am. And I hope that I can continue on this journey and benefit as many people as I can, because at the end of the day, when I die, and I don't know when, we cannot predict that, I should be able to say to myself that every day in my life, I did what I could to the best of my ability to improve myself and to improve the lives of people around me. That is what I want to achieve at the end of the day.
I have so many questions. Thank you,
Go
everyone.
for it.
Thank you for sharing all of that. And there's so many ways that we can, evolve this conversation. But I would like to just hear your thoughts on this. Like, clearly you trained at world-renowned institutions that people go to for medical care, that we as colleagues look towards for leadership. And how did you come to this realization that even in some of the best institutions in the world, like, they weren't getting it right? They were missing the point with the patients. They were practicing medicine in a way that you felt really misaligned. How did you step off that kind of conformity track where everyone thinks what they're doing is right, to say, maybe this isn't right after all?
Excellent question. So I think that, one of the things I want you to look at is the difference between, when we say education in this society, I think we should define it. It's very important to define education. When you go through an institution like medical school is churning out very skilled individuals. These individuals are skilled to make a diagnosis, and these individuals are trained to manage patients, okay? These individuals are not trained to think critically. Number one. Number two, you also have to understand that the knowledge that is being churned out on the conventional side is primarily published in journals that are sponsored by the pharmaceutical industry. So when I was doing my research to know what I can do for my own mental health issues, the research which looked into things like yoga, Tai Chi, Qigong, that is not something that you would see necessarily published in New England Journal or JAMA or the big places, like, where we often are told to look at for the information if we are searching for answers, right? So I think that when we are trained, our training is very biased, number one. Number two, in the training of medicine, we have left the healing part completely. Healing is nowhere. Healing is the ability to align yourself with the patient and be able to listen. The first step of healing is listening, and listening without bias. Imagine a woman comes to you and she says, Dr. Ali, I have 30 pounds to lose, and the physician basically in the conventional thing would say, oh, you must not be eating right and you need to exercise. Has this person really listened to this woman? No, he's already assumed that she is not eating well and she's not exercising. Does this physician have the time to listen to this woman when there is going to be a door knock in about 10 minutes? No. Okay. So you can see that these are the barriers which are there. So these physicians that you see are very skilled. They're highly trained in what they do, but they have been trained to look at something in such a narrow way that they forget the bigger picture. And rather, the training is so narrow that if you see a patient in the hospital who has, for example, a kidney problem and a heart problem, you call a nephrologist in the room, and the nephrologist, meaning the kidney doctor, comes into the room and talks to the patient. The patient says, but doctor, what about the fluid in my heart? And the physician would say, well, I don't know about your heart. I'm just the kidney doctor, which is like, excuse me, but the kidney and the heart are connected. And it's interesting, when I was the attending, I would see exactly opposite notes by nephrologists saying we need to diurese, and cardiologists saying we need some fluids. Just complete opposite, notes, and they have not even communicated with each other to discuss the entire situation. So I think that, we have become now machines, right? So there are protocols. So there is a protocol for treating high blood pressure. There's a protocol for treating congestive heart failure. There's a protocol for treating diabetes. When you make a protocol, you remove thinking out of it. The whole idea of protocol, like when you start to drive, you're very like, okay, what am I doing here? I don't want to crash my car, right? But once you learn to drive, you're listening to the music and you're talking to somebody and you're thinking about 100 things, but it's an automatic behavior, right? A protocol makes things automatic. It standardizes things. There's nothing wrong with making a protocol, but you are forgetting that the protocol is just a suggestion. You're supposed to customize it after listening to the patient.
Yeah.
So for example, you say, well, the protocol of headache says that you have to give Tylenol to the patient. Okay, first line of medication, if you're going to treat headache, you're going to give Tylenol. The patient comes, says, I have a headache, doctor, and the doctor says, okay, I'm going to give you Tylenol. Is that the way the protocol is supposed to go? No, that's not how the protocol is supposed to go. What it means is that the patient is supposed to be asked, so tell me more about your headache. What's going on in your home? Are you under some kind of stress? All of that part is eliminated because there's no time for history taking.
Yeah.
And then here's the Tylenol. Anything else I can do for you? If not, hopefully we'll see you in about 6 months.
Right.
That is the end of conversation. And this happens everywhere. So this is not limited to big institutions or big organizations.
Of course.
So I think that in short, this is the reason why, what you see is highly trained physicians with no critical thinking skills. They've actually lost it during the process.
Where did you learn your critical thinking skills? Like, how did you know? Like, how did you recognize that it wasn't for you?
So I think this is a very good question, because I have to tell you, I was also trained like everybody else.
Sure.
And I can tell you that when a patient would come to me in my office and would say, I have chronic fatigue and the thyroid test would be normal, I'd like, maybe you're depressed or maybe something like that. I really don't know what's going on. I would have done that same thing, like I said, that they would have, until and unless, had I not faced the issue I did face. When I went through my own mental health journey, I knew a lot about SSRIs, which is the first line of medication that we give to people with depression and anxiety. And I knew all the side effects. And I also knew it was a chronic treatment. And I actually had read meta-analysis, which showed that it doesn't really help until and unless you are suicidal. And I was not suicidal, And so at that time, I refused to get the side effects of it. And I said, I have to find an alternate. At that point in time, two things happened. First, the research helped me figure out that there's another option. But more importantly, one of the things I realized, and I asked myself this question, why am I not willing to treat myself with the same medication that I actually prescribe to patients? It was a very a reflective conversation that I had with myself. And I said, you know what? This is not right. I'm giving it because I don't have an option. The answer that I had was I didn't have another option, and that's why I was doing that. And when I found the approach, I was like, that's it. Now I have a better way. And that's when I knew I did not want to turn around. Before that, I didn't know a better way, but now I knew a better way. And I would never, ever, treat somebody with a medication if I had an alternate. If the alternate did not work, that's a separate story.
Yeah.
But to be honest with you, I surprised myself. I'll tell you, this first patient came to me. He was a young guy. He had a baby recently. Baby was 6 months old. He was working, very stressful job. He comes and says, doctor, he came because he went to the ER, chest pain, shortness of breath, and they basically diagnosed him with a panic attack and sent him home. So he came to me and he said, okay, this is the problem. I said, okay. So because he was having panic attacks and, there is, trying to think of the name, Mass General has this Benson Henry Institute where I got training from. And they have this breathing technique that they talk about, right? And I wanted to teach him that, but I was thinking, well, panic attack is a little bit too much. I'm not sure if this breathing thing will help somebody with a panic attack. Maybe a little bit of anxiety, I can do that. So I said, how about I teach you that technique, but then I give you a low dose of something, because I wasn't sure if it's going to work. He said, no, I'm not going to take any medication. I have a baby at home. No, I can't do this. I'm just going to do the breathing. I said, are you sure? He goes, yes. I said, well, but I don't want you back in the ER. So I will teach you the technique. I'll tell you the time when I want you to do it. And then I want you to come back in 2 weeks, because God forbid if things are not getting, better, I want to give you a medication. He goes, yes. 2 weeks later, he doesn't show up for his follow-up. And now I'm worried, maybe he must have gone to the ER. So I tell my admin, I want this guy called and I want him right away. I want him to be seen. So they call him, he finally makes an appointment. He comes in and I'm like, what's going on? You never called back. You never even came for your follow-up. And he goes, but there was nothing to follow up. I'm fine. I feel great. I was like, oh, thank God. And I was like, wow, it actually works with panic attack. Oh, wow, this is so great. So I surprised myself, with the resilience that the human body has and the healing potential it has, and that, those things which I saw with my own eyes in my own patients, this is your case number one. That's your case study. I had so many case studies. I saw one success after another success after another success. And I couldn't believe it initially, because what I was taught and what I was seeing were completely different things, but if you actually witness it, if you see something with your eyes, if you experience it, then you don't need a book to tell you if it's right or wrong. If you put your hand in fire, you get burnt. Then if 100 people tell you there is no fire, you will not believe it, because you have burnt your hand. You know it.
But this is the gap, I think, for a lot of folks who come into medicine who may be people pleasing or perfectionistic or rule following, or they want to be accepted, they want to get promoted and get into great residencies. So they're kind of taught, follow the rules. This is how you get to the next step. And so to make that transition, like you're describing, requires critical thinking, it requires decision making, and that may feel really scary for a lot of people who've never done that before. But the cost of not doing that is our patients. And it's not lost on me that the people who are showing up in our offices are people who at least want Western medicine, right? Like they have decided, okay, well, I'm either so sick after trying to treat myself at home, I'm gonna go in. You and I were talking about healthcare trauma before we started this recording. But there's a whole host of people who don't engage with our healthcare system in America because they don't trust it, because they understand that pharmaceutical companies and insurance companies are the main beneficiary of our healthcare system. And so I think that, we're at a time, particularly in this, we're not post-COVID, but, after this COVID pandemic, where patients don't trust doctors the way that they may historically have done that. And what I hear you doing is closing the gap, not by some mystical voodoo, but by literally spending time with your patients and listening to them and centering the care around what they value and who they are as people. And then you're like a consultant. You're not an omnipotent boss of them. You are a consultant. Yeah. So how do we close the gap with our patients? Like, how do we make this a healing environment for both us as clinicians and patients?
So I think the question is, who wants to close the gap? I think this is the interesting question, is that, you said something very profound. You said, we know, the patients know, we all know that the real beneficiaries are the insurance companies and the pharmaceutical industry, right? And that is why functional medicine is not something that has come out of insurance or pharma industry. It's patients who are doing it. There are patients who are saying, no, enough is enough, right? And so I think that the first and foremost way to bridge this gap is to raise awareness, because I'll tell you something, that I have this woman, right, who came to me, and, she's about 65 years old, she came with severe fatigue, and she had been to every physician, like every specialty, and she has very good insurance, by the way. So she went to every specialist because she has a PPO. So she literally went to every specialist, did a lot of workup. Everything was negative. And she was told that, she must be depressed or something like that, And she was so frustrated when she came to me. She's like, do you think, Dr. Ali, do I need to live? Because, I don't think I can't live like that anymore. Like, I have grandkids. I mean, I have no life, and I'm just basically at home doing nothing. And I said, no, you can. She said, Dr. Ali, you're my last hope, because she had seen everybody and they basically told her she's great. And when we started working with her, right now she has so much energy. I mean, she is having a full life, And she said, just the other day she came to, I'm seeing my my internist. I said, okay, is everything okay? Because she didn't like her internist to start off with. She said, yes, I want to tell her how I'm getting better. I want to tell her that what I said actually made sense. And I want her to know that there's another way, so that any other patient who comes to her, she knows that there's another way out. Now, it's very interesting that if a patient, and if multiple patients, start going to their physicians and saying, no, there's a better way, because it's the physician does not have an ulterior motive here, as you already know. The health providers, the nurse, the physicians, they're all doing their best. If anything, they are also being pushed against the wall. So they have nothing in this game. Like, they're not getting anything in this. So I think that we already have the patients on our side. The second step to get the physicians on our side, because no physician would say no if you give them 15, 20 minutes with the patient. No physician would say, no, I don't want to spend time with the patient, right?
That's right.
Every internist, every family medicine doctor, pediatrician wants to do that. But the question is that if there is going to be a push on the physician side, and the system will again hear that patients want this, that, and the other, then automatically, there is going to, it's like consumer shifting, right? Consumers can shift the game, but not otherwise. So I think the next step would be to get the physicians on board, to be able to say that, yes, we want to give more time, and we want to kind of start looking at what we can do to help the patients, and start listening again, If you cannot figure out a problem, that's okay, because nobody knows everything. It's okay if you don't know the answer to the problem, but to say that the patient is crazy, now that's a different level.
Yeah.
You know,
Well, that is a problem. Yeah.
that is the problem. So you can say, look, I don't know, but let's see, I can send you to somebody, or let's see if I can figure out another way out of the situation, something like that. Acknowledge that you don't know, you want to help but you don't know. That's very good. There's nothing wrong with that.
Yeah. Our patients need us. And I love that you said listening to your patients is how we kind of grow and how we change the system, because, medicine can only, our education can only treat, educate us so much. It can only train us. We spend a lifelong career trying to learn more and more. But everything I know, I've learned from my patients, right? They come in and they say that didn't work, or I had this side effect, or I talked to this other doctor, or my friend saw this person and this is their experience, or I've done my own research, which I know that's like a hot button topic when physicians are like, oh gosh, you got your information from TikTok. But patients are gathering together in spaces that they consider safe to say, these are my symptoms. Does anyone know what's going on? Because my doctors don't. And I love that you say it, it's both. Like, we want to do better. We want to spend more time with our patients. We want to be able to have the answers, but our system is not set up that way. And so even though hospitals are buying up practices left and right, there's so many people like you, like me, like many other of our colleagues who are stepping off of that track and saying, we refuse to continue to injure ourselves and injure our patients in this model that does not put the patient first, because patients deserve that, and so do we.
Absolutely. And I think the other thing, I think this is another thing what physicians can do that you're talking about, that not be part of a system. I'm not part of any health system.
Yeah.
Because if you're part of any health system, the first thing they'll be like, we want you to, you haven't ordered any x-rays. How about you putting referrals to a specialist? Or what about even MRI machine? Well, I know that you have an MRI machine. I know that you have a CAT scan, and I know that you have a lot of physicians who can do catheterizations and surgeries, but my patient does not need it. So the alliance with the health system, comes with such a huge cost. It shouldn't be like that, So this is one of the reasons why I don't align myself with the health system. I'm happy to refer. I refer patients to specialists that are all part of health system. I have no issues with that. But I do not want to take the pressure to do that because you have a quota, that I have to complete. I remember when I was an attending as a hospitalist, and I would come in the morning, my new patients that were assigned to me, they would have, so the patient comes with pneumonia, but he has a history of CKD, chronic kidney disease, and diabetes, and also, fibromyalgia. And in the morning, I see there are 3 referrals. They have called rheumatology and nephrology and endocrinology. And I would get very upset because I would say, why are all these specialists being, called upon? I mean, this is a stable case, And they said, well, most attendings would like us to call consults. I said, I don't want any consults. I'm an internist. I can handle pretty much everything. If I need, I will ask them to help me out. More importantly, I'm thinking of the bill of this patient. We are adding to the bill of this patient who's going to have a heart attack. He came with a pneumonia and he has like 500 specialists on board for no reason.
That's right.
And so I think that, we don't think about the patient. We are just thinking about, okay, what is going to be helping me and my colleagues? This is not something, you're not here to serve your colleagues or your health system. You are supposed to serve the patient. That is your first and foremost priority.
That's right.
Yes, if somebody needs a referral and they are actually in acute renal failure, absolutely you have to call nephrology. Why not? If they have, if they're in DKA, yes, call an endocrinologist to make sure there isn't anything else that they might want to add. But everybody is getting like 3-4 consultations. I mean, this is ridiculous.
It's expressly for the purpose of generating revenue, right?
Right.
Is there anything that feels unsaid that you'd like to share?
Well, I think the one thing I would say is that, one of the things I learned during my own journey, and I'm still on this journey, is that when I was going through my burnout, and you could be going through either emotional burnout or a coping burnout or, a physical burnout, I didn't realize that, I could seek help, to be honest with you. I didn't even have a colleague I could share my story. I didn't even feel safe enough, to share it with a colleague. And it's very hard to share things with a colleague when your work is your primary problem. I mean, you can't talk to your spouse if the spouse is your primary problem, right? So I think that at the time, I didn't realize that there were people who could help me. One of the reasons why mindfulness coaching appeals to me a lot is because, you know, I wanted to help all those who actually went through the same situation as I did. There was a time I actually called the crisis line. I was so desperate and I had nobody to talk to. I almost felt that, I'm just not going to be able to take this anymore. And I actually called the crisis line. And I wish at the time I knew that there were people called coaches, like, that can help you. And I think this is one of the reasons why I feel so blessed to be a mindfulness coach, because I'm able to help people who actually are going through the situation I went through, whether it be emotional burnout or like trauma related burnout or whatever type of burnout that you are facing in life, where you feel stuck, you feel like you can't move anymore, you can't breathe anymore. How do you turn that situation around? And that, I think the message I want to give you is that if you are struggling, don't feel that you're alone or that this is a unique journey. A lot of us, you may have a unique journey, like every one of us has a unique journey, but a lot of us have gone through the same struggles or at least similar struggles. And so don't wait, till you get to the point like I got to, meaning I crashed and I then resigned. I think if I had a coach, my journey might have been more of a smoother curve than, you hit and then you go back. And so I think my suggestion would be that if you are going through a difficult situation in life, no matter what that area could be, seek help, because now we know much more about this and we can definitely help you out.
It's not just you.
That's not just you. Absolutely.
Thank you for being here. I'm gonna stop our recording.